documents circulated before the meeting, and maybe you had time to look through, but we'll be going through a lot of it today. Today we are very privileged to welcome Vicky Metcalf on behalf of the IASC Community of Practice, which was formerly a task force, and now it's a community of practice, and she has been instrumental in developing these benchmarks. Went through a consultative process. It went through field testing with key clusters back in 2023 to 24, and now this is the implementation stage, the rollout of it. So the benchmarks will be sent out to all the HCs by the ERC, and the community of practice with Vicky is following up with clusters and HCTs, etc. And 2 or 3 HCTs are being identified to be targeted for specific support. And at the same time, we, the shelter cluster, are one of the 3 privileged clusters to be identified as key clusters to start this rollout. So these sessions are part of the knowledge sharing and really gathering experiences, sharing it, so that we're fully equipped as a cluster to engage in these benchmarks. We have had 2 sessions already, and this is the last one, and we've done it in terms of time zones, so everybody has had the chance to take part within all this within all the clusters. So protection, centrality of protection, the benchmarks. One of the key roles of the shelter cluster is specifically to raise awareness from the physical living environment angle. And I and many of us do believe that having a safe and dignified shelter to live in after and during a crisis is vital to enhance protection outcomes. So today it's all about how do our sector contribute to those protection outcomes. And we're really looking forward to hearing all of your inputs and what you've done in your cluster, in your countries, and what works, what doesn't work, etc. And the benchmarks, importantly, this is an exchange kind of platform which Vicky will be facilitating. So please don't be shy to share anything. Challenge ourselves, challenge the system in a way to make it easier or more efficient for us to contribute to those protection outcomes. So with that, I'm going to hand over to Caroline. Thanks.
Thank you. Thank you very much, Seki. For those who don't know me, I'm Caroline de Waast. I'm the Deputy Coordinator for the Global Shelter Cluster on IFRC side. And I don't want to repeat what Seki has already covered in introducing this session, but I'm very pleased that we're able to run this session together with all our clusters, whether on more conflict-related issues or disaster context, and many of the contexts in which we deal with have both weather events, disasters, and conflicts. And the issues around protection can vary depending on the context, on the situation. And so I really invite everyone here, everyone on the call, to share experiences on how you've had to integrate protection-related issues in your strategy with your partners, working with the protection cluster as well, and some of the areas of responsibilities, some of the AORs, particularly on housing, land, and property rights. We've had a lot of discussion on HLP in past in past sessions, but not only. I think there's a lot of rich experience from everyone online. So as Seki mentioned, this is more of a workshop. Vicky, who is the expert on the topic, will be presenting the benchmarks and really asking for all of you to share some of your experiences, also successes, and maybe challenges you faced in the different contexts you've worked in. So without further ado, over to you, Vicky. Thank you very much for this session, and I look forward to hearing from everyone. Thanks. Over.
Thanks, Caroline, and thanks, Seki, as well. And thanks to all of you for joining us today, this morning, this afternoon, this evening. I know it's late for some of you and quite early for others, so welcome to all of you. Maybe just before I start, so I'm an independent consultant working for the community of practice. As Seki mentioned, I was leading the drafting of the benchmarks and also the aid memoir. And then currently, of course, working on behalf of the community of practice with the 3 key clusters we're working with, also with OCHA and its intercluster coordinators, and hopefully shortly with some HCTs to help roll out this new tool, the benchmarks. And in doing so, to also remind ourselves or explain further what the centrality of protection means. So this is the third in a series of workshops with you as shelter cluster coordinators. We're also finishing up the third session with protection cluster coordinators tomorrow afternoon. And then hopefully we'll be working with the food security cluster and, as I said, also with OCHA's intercluster coordinators too. So you're part of this wider rollout process. As Seki said, it's meant to be a working level exchange with you. Up front, I will disclose that I am not a shelter expert in any way. So apologies for any silly comments from me on shelter or misunderstandings. So I'm really looking forward to learning from you, but also exchanging learning with you about how we can really consider utilising the important interventions in the shelter sector, shelter cluster, to also try and reduce some of those protection risks that all of us as humanitarians are concerned about and want to try and reduce. So as I mentioned, this is part of a wider rollout. We will be working with a handful of HCTs. Those HCTs have not been selected yet. So there is an opportunity for you, if you would like, or you think your HCT might benefit from some targeted support in understanding what centrality of protection means and helping them work out in practice what they can do to embed protection at the heart of their operational response, then please feel free to either mention this in the course of today's session, or please feel free to follow up with me via Marmon, Caroline, and or Seki as well. I'll also put my email address at the end of the session, so you're welcome to contact me directly if you think your HCT might benefit or be interested in this kind of discussion. So just to remind ourselves what the purpose of today's session is, Seki and Caroline touched on it, but I'll just go over it. So firstly, we're going to remind ourselves of what centrality of protection is. So conceptually, what is it? And then what does it mean in practice in a more operational sense? Then we're going to look at the benchmarks themselves and walk through that document to explore what the 3 benchmarks are, what they mean, who that document is meant to be used by, and how it could be used by you as shelter cluster coordinators. So I'll have some tentative thoughts on what you can do or what the benchmarks mean for you as shelter cluster coordinators, but I'm really interested to hear from you whether you think that's correct or whether we need to change some of those aspects to make sure it's as accurate as possible. And in general, throughout today's session, as both Caroline and Seki have mentioned, I'd really like to hear from you what you and your cluster are already doing on protection. From the discussions we've had so far with other regions, it's clear that there's an awful lot that is happening. There's a lot of collaboration between your cluster and the protection cluster, for example, and with other clusters too, to try to reduce some of the protection risks that you can address to an extent through shelter intervention. So I'm really interested to hear some of the examples from you. And I can see already from the chat, there's a wide range of context that you guys are representing here today, from Syria to Vanuatu. So that's quite a broad range. So I'm really curious to hear what you can share with us. So does that sound useful to all of you? Are there any aspects that you think you would like to hear us talk about in the session today? If so, either please let me know now or put it in the chat and one of us will pick that up. Maybe just to say, for those who've joined a few minutes later, if you could put in the chat or introduce yourself in the chat, so let me know your name and which country operation you're representing, just so we can keep track, because there's quite a lot of you today, which is great, but we want to make sure we're aware of who everybody is from and which context you're joining from. And then maybe just a last quick comment to say that we have a couple of other colleagues from outside the cluster joining us today. So my colleague Gree from the Global Protection Cluster is online and listening in, because of course, as I said before, there's a lot of collaboration already between yourselves and the Protection Cluster. So the Global Protection Cluster has been sitting in all of these sessions with us. So Gree, I don't know if you want to put your camera on it and give everybody a wave so they know who you are.
Already done, Vicky.
Oh, great, thanks. I think we'll also have Jim Robinson joining us from the Housing, Land and Property, AOR, of that Global Protection Cluster as well. If he's not here already, sorry, I can't see you, Jim, because my screen is compartmentalized. Then also we have Jane Cocking, who's put her camera on. Thanks, Jane, I can see you. Jane is also a consultant working for Interaction in support of some of the work that the community of practice is doing. So she asked if she could listen into some of these discussions, because I think some of her future work coming up might touch on a lot of the topics we'll be talking about today. So
thank you.
Thanks, Jane. Without much further ado, let's get on with this session, if that's all right. And everybody listening, feel free to stop me if you have any questions at any time. Either put your hand up using the function on the screen, or just indicate that you'd like to speak. Okay, right. Marman, if you could go to the first slide, please, that would be great. So I'm sure many of you have seen this before, but before we dive into the centrality of protection as a concept and an operational approach, I thought it might be useful to remind us all of what a protection risk is and how we can reduce those risks that affected people are facing. So I don't necessarily expect you all to be experts in the protection field, much like I'm not an expert in shelter. So I thought it might be useful to just remind ourselves of this. For those who do know this and are more familiar with it, then just bear with us for a couple of minutes. Okay, what you can see on screen is the protection risk equation. So in the last few years, the Interagency Standing Committee, the IASC, has adopted this risk-based approach to protection. That's how they are explaining it and understanding it. So a protection risk is a violation or an imminent violation of an individual or a group's rights as provided for under international humanitarian, human rights, or refugee law. And that risk equation that you can see on the screen helps us break down that a little bit. So it describes how a risk is a combination of a threat, and I'm going to use a couple of examples that hopefully resonate with you in the shelter sector. So the threat, for example, might be a threat of forced eviction of vulnerable IDP tenants living in an urban area due to increasing rental prices. It's a combination of that plus an individual or a group's vulnerability to that particular threat. So in this case, perhaps female-headed households might be more vulnerable to that threat of forced eviction because they don't have a male protector, because they have limited influence over their landlords, and perhaps because they have limited income to support themselves and respond to those rental price increases. It's also the combination of the capacity of an individual or a group to resist or rebound from that threat. So in this case, those female-headed households will always have some kind of agency, some kind of capacity. Perhaps, for example, they're aware of their tenancy rights under domestic law and understand that they can use legal channels to protect themselves from that threat of forced eviction, but maybe they just don't have the access to those legal channels to take action. So in breaking down the risk in this way into that combination of threat, vulnerability, and capacity, we can also see more concretely what actions we could take as humanitarian actors to try to reduce that risk overall. And we're going to look at that on the next slide now to think about what we might do. So taking again that example of forced eviction. So what actions could humanitarians take to reduce that threat? Let's break it down as per that risk equation into the actions to reduce the threat, actions to reduce the vulnerabilities that people might have to that threat, and to enhance or improve or increase the capacities that that individual or group might have to respond to that threat themselves. So this, I'm not an expert, as I said before. These are some examples on the screen of the types of action you might consider taking as shelter actors to try to reduce that threat, reduce the vulnerability, and increase those capacities. I won't run through them all, but just to highlight a couple. So you might try to reduce the threat of forced eviction by lobbying local authorities to strengthen their efforts to guarantee tenancy rights, or perhaps to make long-term housing arrangements for more vulnerable households. You might try to reduce the vulnerabilities of particular groups, and I mentioned female-headed households, for example, by providing cash support or rental subsidies to them. And there are other actions you might take too, of course. And we might, or you might, try and augment households' capacities by referring them to legal aid services to challenge the forced evictions, and or perhaps help them organise themselves into networks that they can then use to lobby local authorities for longer-term housing arrangements for them. So just looking at those examples on the screen, I wondered if anybody had any thoughts or comments, or perhaps had any alternative suggestions of actions you might take in any of those three areas of reducing a threat, reducing the vulnerabilities, or increasing the affected people's capacities to respond to that threat. Does that sound reasonable, that set of actions to you? Any thoughts or reactions? Sumera? And thanks
Yes,
for the other hands up.
Just a small bit here. In Pakistan, the context is we not only lobby with the government and development partners, but we also have to lobby with the landlords, for securing the land rights and securing the security of the tenure for longer term. Because in Sindh, where at the moment after 2022 flood, there is massive reconstruction in Pakistan, which is globally the massive housing program. So we had to facilitate the negotiation between the landlord and the house, I won't say house owner, but household, to have the security of tenure for living in there, because they're usually the tenant farmers. So they do not have any land rights. So they have to, they are dependent upon the landlord only. So that's the small bit which I wanted to add, because it's only talking about government and development partners. So it's broader than government and development partners, but also the other groups on ground. Thank you.
Thanks, Mara. So yes, you're right, the private sector as well, individual landlords or landlord associations maybe as well, depending on the context. Thank you for that. I can't see your name, but it's a colleague from the Philippines cluster. Please go ahead.
Hi, good afternoon. This is Leo from the Philippines. I think there's also what I don't see here, but I think there's also another level of like the cluster with shelter cluster and protection cluster is doing, and this is what we are doing here in the Philippines. We do say safeguarding of the land rights, meaning while we don't while we provide networks to the referral networks for them to tap onto legal aid, or even for them to ensure that they are not evicted out. In the Philippines, became a practice is that we provided like some of the agencies, and then it got adopted across the cluster. Is that there's a document. It's called kasunduan, or an agreement. So it's basically, this is a templated document wherein you could go to your village chairman or chieftain and sign that you'd be using the land, the property for 5 years, so that you could put in a transitional shelter to that one. So it's safeguarding, like putting at the safeguarding measures to that one. So it could be either for tenancy, for user frac. There are also instances where the discussion together with CCCM cluster is talking to government, and to say coming up, assisting the government in ensuring that there is right ordinances, so that shelter cluster agencies, that would shelter implementing agencies, would be ensured that if they are to construct transitional shelters in public lands, on government lands, that wouldn't be utilized by the government. It wouldn't be confiscated by the government for other purposes for at least between 5 to 10 years. And that has been a practice in the Philippines. Thank you. So the word is safeguarding.
That's great. Thanks so much for sharing that example. That's a really interesting one. The next colleague who has their hand up, apologies for my mispronunciation of your name, but is it Wayu? If I can give you the last moment to speak on this, and then we'll move through the next slides. But for the rest of you, also please feel free to chip in later as we go through. Just in the interest of time, I'll move on after this speaker. Wayu, would you like to go ahead?
Yeah, thank you so much. Just to add about the threat, actually in Indonesia, just an example, in Indonesia, there is a lot of indigenous land, which is sometimes we also need to, connect and communicate with the traditional leaders. That's one thing. That's also will be related with how we can make the land more safe for and supporting, especially during the emergency, and giving the protection to the the IDPs, for example. And the second one, actually, this is just an initial idea right now, which is we will launch on the communication with the with some of the focal point here in Indonesia. I mean, shelter actors here in Indonesia and government. It's about the potential of a wakaf, land wakaf. I'm not sure in English, but this wakaf is kind of like a in Muslim, it's like that Muslim is giving something, can be money, can be land, that can be used for the social activities. And I think that's something that will be also related with the capacities, and as also the threat. Thank you.
That's great. Thanks so much, Wayu, for your intervention. That's really useful. Okay, so quite a lot already, I think, isn't there, that you guys do that you can see contributes to reducing the threat of a particular protection risk, reducing the vulnerabilities of specific individuals, households or groups to that threat, and then interventions to support increased capacities of those individuals or groups or communities to respond to that threat themselves, with a range of operational responses, advocacy, engagement, across a wide range. So that's really great. You guys obviously know this stuff already. So that's what we're talking about in terms of protection risks. What we're going to do now is move on to what is the centrality of protection, because there's a lot of confusion between protection and centrality of protection. So let's remind ourselves of that concept. So if you could move to the next slide, Marmin. Thank you. Great. So these are on the screen there that you can see some basic headlines from the policy that was issued by the IASC back in 2016. That policy is called the IASC Policy on Protection in Humanitarian Action. We commonly refer to it as the Centrality of Protection Policy. That's partly shorthand, but also because the policy came shortly after a statement issued by the IASC principals in 2013 that did have the title of Centrality of Protection in it. And the policy elaborated on that statement and provided much more detail than the one-page statement that the principals issued at that time on this topic. So maybe just to mention that some of you might be aware that there's a recent independent review of the implementation of this policy. I think it was 22-23. Jane led that process, so Jane will correct me if I've got the dates wrong. And if I may say, the evaluation or the review, the results that it found were quite damning of all of us in the humanitarian sector. Rightly so. We have not collectively or individually as members of the IASC done a great deal since 2016 to actually implement that policy for lots of different reasons. The review itself has spurred some more recent momentum, including at the principals level, to step up efforts to implement that policy at the country level in particular. And that's really one of the factors that drove this process of developing the benchmarks that we're talking about today. So let's just look again at what is in that policy itself. So a couple of key headlines. Of course, the document is longer than this. I think it was shared with the invite that you all received. So if you've got time, please feel free to go back and look at that document as well. So the IASC members are all required under that policy to work together to understand or analyse and seek to prevent, mitigate or end protection risks. And again, we know what protection risks are. They are violations of international humanitarian human rights and or refugee law. The policy is very clear that this should be collective action and it should be taken at the global, regional and country level. So we're not just talking about country level, although that's where a lot of the actual effort is focused. And that's what the benchmarks are designed in particular to support country level action. So at the country level, under the leadership of the humanitarian and/or resident coordinator, all HCT members, so all organisations that are members of the HCT, have a responsibility to contribute to a collective protection response, drawing on their individual mandate, expertise and capacities. And every HCT looks slightly different. The capacities, the members of it are always slightly different. But what we would generally say is that there is a breadth of capacity across an HCT from national and international organisations that are members of it that should be brought to bear to try to reduce some of the most serious protection risks that are arising in that context. And of course, maybe the obvious thing to say that the policy highlights is that an HCT's collective protection response must be underpinned by, of course, humanitarian principles and international law, particularly those three sets of law I've mentioned, and it should be designed and undertaken with affected people. I think many of you are very familiar with the accountability to affected people agenda. And I think in the shelter sector, you probably work really closely with communities. So the policy really highlights how important that is, and we'll talk about that again in a minute. The policy also emphasises the importance of supporting both affected people and other local actors' capacities. And again, that will come out in the conversation we will be continuing. If you could go to the next slide, please, Marman. So what does operationalizing the centrality of protection mean? So in the policy, it asks the HCT to set some priorities. It recognises that in any given context, and many of you are working in really complicated crises, that in any of those crises, there are a wide range of protection risks that are affecting the civilian population. And of course, the HCT cannot work on all of those. So they really need to think about focusing on 1, 2, or a maximum of 3 of those serious protection risks and where they're going to place their collective HCT efforts. So identifying and agreeing on priorities is really challenging. And we know that. I've worked in the field for a long time, in OCHA in particular, and it's always very difficult to get an HCT to agree on a common set of priorities in any context. And on protection risks, it's particularly hard sometimes. So what we thought would be useful is to share with you on the screen here a few examples from some HCTs that have gone already through this process to identify some protection risks that they want to work on together as priorities. So you'll see on the screen, it's a little bit conflict focused. So I'll be really interested if any of you from more disaster focused contexts have examples you might be able to share with us. But you can see that even within those predominantly conflict related contexts, there are some quite wide ranging priorities that HCTs have come up with. Really what we can see from this is that those priorities will be entirely dependent on the context, on the relevance of the particular risk to humanitarian action. So is it something that humanitarians can try to reduce? Because there are, of course, protection risks that we would find very difficult to address. It also depends on the mandate of the HCT and very pragmatically on the capacities that the HCT has to act. And those capacities can be both the resources, the funding, but also the influence, the leverage that an HCT might have on duty bearers, that is those entities, individuals or institutions that have the responsibility domestically to uphold the rights of the civilian population living in those contexts. So you can see there's quite a wide range there. I'll just pause and ask if any of those examples resonate with any of you. I think we have a colleague online from Syria. So for example, you'll see I've taken one from the Northwest Syria strategy that they developed recently. And or is anybody from a more disaster-prone context, for example, who where the HCT has developed some kind of protection priority? Just in case anybody has any examples they'd like to share here. Chung Kyu, would you like to tell us? If I've pronounced your name right, sorry everybody for my mispronunciation always.
Hi, this is CK from OPT. Yeah, definitely. It seems like according to the example shared, like Syria, Afghanistan, Somalia, it seems like we're facing similar situations. So before the ceasefire until last 19th January, so there has been a lot of the challenges, especially for the access. So we didn't really have a structured response mechanism, especially in Gaza. And because of that, it is making us more responsive and reactive rather than proactively providing the other shelter assistance. And also this actually led us, but after the ceasefire, at least this access challenge was lifted. So what we have done is developing and introducing multi-cluster referral system. So it has been existing, but on the other hand, it has been not been really used previously. So during the ceasefire, we developed protection and the shelter cluster referral system first, and to further develop and to be used by the multiple cluster. And also, because of the responsive modality, it was impossible to have like more systemized response system. So during the ceasefire, and also we developed the geo-split based responsive mechanism to defining the AOR of each agency. And also to minimize the duplication, also we're developing the database so that we can deduplicate the assistance. In this procedure, we're also, there has been predefined vulnerability criteria, but basically we have been distributing like, the blanket, previously, the modality was the more of the blanket distribution in the very limited time. But during the ceasefire, we also further elaborated the vulnerability criteria and the prioritization. And since the 2nd of March, we are not bringing any humanitarian assistance inside of the Gaza. So the importance of the vulnerability prioritization is more, became more important. And also, we noticed that we didn't really have any like gender, age, vulnerability-based data collection. So we initiated at the shelter cluster level, promoting all the other partners to collect the data based on the gender, age, and disability, so that we can have better understanding, the proper, more prioritized assistance was provided to the most needed vulnerable group. That's the case that we are working on right now and has been progressing since the middle of the January, 19th of January, until the ceasefire breakdown on the 8th, 19th March. So that's what we have been doing in OPT over the year.
Thanks so much for that. I think that's really useful, actually. You're leading me into the next slide. So if I can go to that, please, Marmon, which is we're going to talk next about what are generally the different types of action that are outlined in the policy. And I think some of the discussion or some of the examples you've just shared with us from Palestine illustrate some of those. So I'm going to flag those as we go through this list on the screen now. So what the policy says is that an HCT together needs to take a combination of actions at the institutional level, so individual organisations, and at interagency levels, which might be both the cluster and the HCT level, for example, and intercluster level, sorry, to address some of those agreed priority protection risks that the HCT is working on. So there were 4 areas of action that were primarily outlined in the policy, and I'm just going to explain them with some shelter examples I've inserted here as well, but please feel free to come in. And also I think those examples from Palestine, I'll just highlight those as we speak about this as well. So these are not in a particular order of importance. All of these areas of action, the 4 on screen, should be undertaken in a combination. The first one I wanted to illustrate to you is mainstreaming protection. So that is a set of activities you would undertake to design and deliver interventions, programs, projects, any type of intervention in a way specifically that does not create new or exacerbate or increase existing risks that crisis affected people are facing. So I tried to put in some shelter examples here. I'm sure you've got better ones. But here, for example, providing shelter materials and appropriate distancing between dwellings to provide maximum privacy and dignity for households. You talked just then in terms of Palestine about referral systems So you as shelter actors in your shelter cluster, you're not necessarily protection specialists, but you are able to help identify and refer individuals or households or even groups for specific support from those who do have protection specialist expertise on a wide range of issues, whether child protection, gender-based violence, etc. So that would come under mainstreaming protection. The second category to highlight to you is integrating protection. And this was a new concept outlined in that policy in 2016. And to be frank with you all, there wasn't really any guidance issued after the policy to explain what integrating protection means. But in essence, what it is protection and other sectoral objectives are combined in one program or interventional project. Here, for example, a joint shelter and protection cluster program might be trying to reduce the risk of forced eviction through combining rental subsidies and support to landlords for shelter upgrades with advocacy with local authorities on longer-term shelter solutions for IDP households. So some of you already talked earlier about your examples of those kind of interventions. So where you're working not just with shelter-specific operational objectives, but where you've explicitly included a protection objective in your intervention as well. That's when we talk about integrated protection. The third category is advocating on protection, and many of you have already highlighted some examples there, whether it's with the private sector, with government authorities, with traditional leaders, for example, I think were some of the advocacy targets that were mentioned already. So by advocacy, what we mean is engaging duty bearers, that is the state and non-state actors, individuals or institutions that have a responsibility to uphold the civilian population's human rights. So engaging them on a bilateral basis or as part of some kind of collective strategy. That might be a strategy of the HCT, of the cluster itself, or whatever it might be. The aim of which is to secure better protection of affected people. So to try to secure their rights, to encourage those duty bearers to take action to uphold the rights of those particular people. So for example, here it might be that you as the shelter cluster contribute evidence and language messaging, for example, for the humanitarian coordinator and the HCT to use in their key messages on the conflict-related impact on the right to adequate housing. So referencing our colleague who just spoke from Palestine, I know, for example, the Palestine shelter cluster in Gaza has, over the course of the current armed conflict, collected some really detailed data on how many or how much destruction and damage there has been to residential properties. And you can see those figures and that information used very often in advocacy by the humanitarian coordinator, by a number of the different agencies, both locally in the region, but also at the international level. So you can see how you as the shelter cluster have fed into those interagency messages and advocacy. The last category is specialised protection services. So that is hopefully fairly obvious. It's the specialised activities and programmes implemented by specialist protection mandated organisations that are designed to meet targeted protection objectives. So that would be child protection, mine action, in our case here, particularly relevant housing, land and property rights, for example. So that could be the protection cluster members supporting displaced households to obtain replacement legal identity documentation that they've lost in the course of their displacement, to facilitate them accessing their housing, land and property rights, as well as their rights of access to health, education and other essential services. I think somebody mentioned earlier on the provision of legal aid for those whose housing, land and property rights are being infringed. So again, that probably in most cases would be provided, that legal aid service would be provided by a specialist protection organisation. It might be a UN agency, or it more often will be either an international or a local NGO, for example, or other type of local actor who can engage on that topic. So those are the four main categories of action that the HCT is expected to take in combination. As I said before, these are not sequential. There isn't a hierarchy particularly outlined in the document. These are meant to be 4 areas of action that are undertaken by members of the HCT in some kind of combination that hopefully is strategic. As I mentioned, I inserted some shelter-specific examples, but please feel free to tell me of any others. Maybe just to clarify, mainstreaming protection versus integrating protection. What's the difference between them? It's a quite grey area. It's a very subjective call that we can make. There is often a lot of overlap between these two categories, but just to reiterate that the difference between the two, mainstreaming and integrating, is that integrating protection involves a much more proactive effort. You are explicitly adapting a sectoral intervention in food, security, in health, in WASH, in this case in shelter, specifically to also reduce the protection risk that you've identified in that environment or being perpetrated by actors in that environment. So as I said, all of these four areas of action are equally important, and each will be done by different actors or entities within that unit, within that HCT, and also at different levels. So maybe just to outline how this plays out in practice. So the HCT, who is the HCT? It's actually the leaders of the organisation. So it's comprised of country directors, heads of organisations in that particular context. And what would they do as a group of individuals? So would they be mainstream protection? Probably not. If you look at that list of four areas of action, what they would mostly be doing in this case is advocating on protection. They would hopefully be using their relationship with duty bearers or other key stakeholders to advocate for those duty bearers to take action in line with their obligations under international law to protect the civilian population. An HCT, i.e. the heads of organisations, we would also expect them to make appropriate allocations of collective resources to support the programmatic response that the HCT at the cluster level would be undertaking to respond to those protection risks. So collective resources might be a country-based pooled fund of some kind, for example. It might be SURF funds that are coming in. It might be allocation of specific technical capacities of individuals within the HCT member organisations who could be brought together to take particular actions. At the intercluster level, so the next level down, let's think of it that way, the policy expects clusters to work together, so across clusters, to assess those protection risks, to contribute analysis from each of your cluster perspectives towards understanding what the protection risks are and how they affect different groups and different individuals amongst the civilian population. They should support the HCT in making decisions on which of those risks to prioritise for collective action, particularly based on the preferences or the perspectives of affected people, and then to work together at the programmatic level to, yes, mainstream protection in each of their interventions at the sectoral or cluster level, and also to integrate protection, so to be more explicitly trying to reduce protection risks. So integrating protection, as I mentioned before, could be through joint programming between clusters, for example. And I'm sure that many of you will be able to share some examples of that in your context. Maybe one to throw out for you here. In one of the past sessions we did with your colleagues in, I think it was in actually the African context, but someone who'd been in the Turkey earthquake response a couple of years ago, the Turkey Northwest Syria earthquake. They were describing how in that context, the shelter, protection, WASH and health clusters, I think it was, worked together to identify that exclusion of certain groups was becoming a major protection risk and having a major impact on people's needs. The exclusion was being undertaken by the local authorities on the Turkish side who were responding to the crisis. And this was having a major impact on the affected communities. And those clusters pushed this topic up to the HCT level and really push the HCT to take this protection risk as a priority and use their leverage with the local authorities to raise it and ask them to change their policy with regard to the communities that were being excluded. So that's an example where clusters have come together, not just one or two, but a group of them came together in identifying a particular problem and then pushing the HCT, so the leaders of the HC member organisations, to act on it at their level. Then going down a notch, you've got the cluster level. So within each cluster, so shelter, WASH, food security, whichever one it is, each cluster is expected to contribute to the HCT's efforts through contributing their analysis. And for example, in Palestine, I think it was, you talked about stepping up the data collection on age, gender and diversity, for example. So you might, in that case, have contributed some of that data and analysis to the HCT's analytical process to understand what key protection risks are and how different groups are affected differently. For example, each cluster would also be expected, as I said, to mainstream protection throughout all of their activities. So that's making sure that every single project and every intervention does not create further harm to the population that it's intended to support. And wherever possible, adopting specific objectives on protection within their particular strategy. And again, you guys have given some examples already. Then finally, at the organizational or institutional level, each member organization of an HCT is expected under this policy to contribute to the collective effort in all of those areas where they have a particular role to play. Many of the organizations won't be specialist protection actors, so they won't be delivering specialist protection services, but they certainly should be mainstreaming protection all the time. They should be trying whenever they can to integrate protection, and they should be trying to either contribute to or engage in advocacy on protection risk with duty bearers of different kinds. And that might be analysis, as we've said, or it might be actually using a relationship that that organisation has with a particular duty bearer. So again, it's the combination of these different actions at these different levels, which will add up to that collective response of the HCT overall, and leveraging therefore all available capacities in that group of organisation that makes up the HCT to reduce those protection risks that they've identified as priorities. So I've talked a lot there, sorry, I'm bombarding you. I'll just pause in case you have any questions about those 4 areas of action. If you have any examples you'd like to share of that, does it make sense to you the way I've just described it? Any questions or examples? I think something came up in the chat, but please feel free to put your hands up if you'd like to speak as well. So Wahyu, you've said here in Indonesia, the shelter cluster is part of the National Displacement and Protection Cluster. Is it mainstream or integrating? Just being part of the cluster doesn't necessarily make it mainstreaming or integrating. It's the actual activities that you would be doing that would determine whether you're mainstreaming or integrating. So if you had an example of the actions that you've done as a cluster, then I would be able to give you an opinion on that. I wouldn't get too hung up on mainstreaming versus integrating, other than to know that you should definitely be doing both. The first one, mainstreaming, is critical all the time, and integrating, where you can be more ambitious, perhaps that's the way to understand it, where you're more ambitiously trying to reduce a protection risk whenever you can, whereas mainstream must be done consistently all the time, although that is very difficult to do, I know. I think I have a hand up. Would you like to go ahead?
Yeah, thank you. This is Momoni from Shelter Cluster. Just want to share maybe some experiences that we are doing here as part of mainstreaming on the protection. So we have in Ethiopia, we have 2-fold disbursements. One is due to conflict, and the other is due to the disasters that we have been having, such as the earthquake and landslide. So as part of mainstreaming protection, we have been rolling out a series of sessions on capacity strengthening, especially focusing on conflict sensitivity, so that our partners have recognized and mitigated unintended negative impacts of aid in contested settings. So in our areas, we have some locations that are labeled as contested, which are causing conflict between 2 regional administrations within the country, and we have been providing this conflict sensitivity training as part of mitigation measure to prevent any unintended negative impacts on our emergency shelter and fire support. Additionally, we have been supporting the cluster partners by providing the age and disability inclusion, particularly in the onset of the emergencies and the disaster as well. Most of the vulnerable population, especially the older people and the disabled, are those who are highly exposed, and we have been coordinating with one of the protection actors here in Ethiopia, which is Help Age, and we have been providing this age and disability inclusion training for our partners, along with some of the good distribution practices the partners should follow up when they organize shelter and fire distributions in any of the locations. Yeah, that's it. Thank you. Over.
That's great. That's some really good examples, actually. Thank you for that. Would anybody else like to share any examples that you might have? Another one I came up with actually from reading a little bit about your cluster more recently, in the Middle East, I think this came up in particular, so whether this resonates with the colleagues in Syria and Palestine and others from the region today. So, for example, how important it is to do a rental market assessment to understand whether cash support might raise rental prices. So we've seen that in the early days of some of the responses to the sort of post-Syria, the outbreak of that conflict in Syria and the regional impact of that. We saw some negative impacts of some shelter interventions just because there was a rush to support people with shelter rental subsidies, and then that had a knock-on impact on some of the rental prices in the local market. So I'm trying to do a rental market assessment before you decide on what's the best way to support people in those urban environments in particular. I think clearly now it is certainly best practice and hopefully done by your clusters in many countries as well. Sumaira, I think, is it? Do you have your hand up?
Yes, I just wanted to share our examples from our region, Pakistan, related to disaster impact. Like we're working in post-disaster, post-flood scenario in Pakistan. So our situation a little bit different in the sense that we've moved from emergency shelter stage towards the more permanent housing reconstruction, and then for permanent housing reconstruction. So our way is to identify the women-headed households and support them to extra mile in terms of providing them with the construction skills trainings for monitoring the construction work, but also we help them with the labor cost and other things, because the government gives a subsidy which is standard for all, but which is not sometimes sufficient for building one room pakka house. So that's one thing. The other thing is that for integrating the protection, we try and work very closely with the wash sector and also livelihood sector, because the wash sector, if we talk about the permanent house, and like in Pakistan context, in Sindh, we started how biggest housing reconstruction project, but it was only giving one room per household, and there was no wash facility, no water, no sanitation initially. But now the banks and others have realized that the wash is equally an important element. And the UN agencies, the shelter sector, we were able to make an influence, and we've ensured that the wash is coming together with it. Since the funding is very limited at the moment, so we're going for community level wash support, which is also not a very good idea, because when you do the community level things, then the maintenance is an issue, and the women are not very open to use the combined toilets in especially in dark. So these things we try and integrate and work together with the wash sector and also the protection sector. For advocating on protection, I've already shared that we had to advocate a lot through the government of Sindh, and then this SPHF and the Sindh housing recovery platform. So we had to do a lot of advocacy that this protection elements need to come in, and these are very important to ensure that the vulnerable groups are safe. So there are a lot of people who got who were disabled, but also got affected by floods and got disabled during the flood time. So they need to also be incorporated within the shelter and housing design situation. So this is just to share our example, which is a little bit different than what you're sharing. Thank you.
Thanks, Samira. I mean, different context maybe, but the principles are very much the same. So you're looking there at ensuring that you're not excluding particularly vulnerable groups. You're understanding that their vulnerabilities are assessed and then the assistance targeted on that basis. You're looking at, prevention of gender-based violence, for example. I guess that was one of the factors, looking at the wash support and washing facilities and how to upgrade that appropriately. And those are issues that we see in all kinds of contexts, aren't they? They're not just disaster specific. So thank you for sharing those. I think they resonate with many of your colleagues elsewhere too. Is it Leo from the Philippines, I think? Do you want to speak?
Yeah, yeah. Also, I just wanted to share. So here in the Philippines, also some of the unique things. we do a lot also of like a lot of working together with other with protection and CCM, doing mainstreaming in protection, integrating protection, advocating for protection and specialized protection services. So, but there's one thing also that I would say one pretty unique thing here in the Philippines is on advocating for protection. So, and I think Caroline has been part of the team that started to develop the when 10 years ago or 11 years ago for Typhoon Haiyan, we had we released an advocacy document on particularly addressing on families and communities living in no-build zones, and that the government had excluded them from receiving humanitarian assistance, particularly shelter assistance, wherein at the time the way we had addressed it was that why for those building or for those infrastructures and families into those areas, there was an identification of if families are in the no build zone, the advocacy was initially was saying, okay, during the day you could still continues to stay there, but you cannot dwell on those areas. You could continue to do your livelihood activities, but you have to stay somewhere out. And that advocacy document from 11 years ago has totally evolved to what is now the current advocacy document that we had worked together with the protection cluster, where we are saying that because there are instances still in after disasters where there are families are living in no build zones. So let's say, for example, right beside the shoreline, and that the government and the community couldn't identify the relocation sites, then it forces the families to go back to these areas. But then the position again with the government is saying, no, you don't want to provide assistance. So what we did was that release an advocacy document that's saying we would provide shelter enclosure materials so that it would protect the families from like the from protection from elements, secure their from security risk and health risk. So that is a document that we and an advocacy that has been totally that has been endorsed by the HCT towards that one, so that it enables the humanitarian agencies to provide assistance, particularly in providing a secure, safe, and decent space for families, and on top of it, like for families to receive humanitarian assistance for those who are located in no build zones and no dwelling zones. So that's one of the unique experience for here in the Philippines.
That's great. Thanks for sharing that, Leo. That might be an example that we want to follow up with actually to see if we can document that, particularly because you've got a good period of time there where you can track the impact that initiative had over the last 10 or 11 years. So we might come back to you bilaterally after the session if you don't mind to find out a bit more about that, perhaps with inputs from Caroline. So thanks for sharing. I can also see that Chung Q has put an example in the chat there with regard to shelter operations in the West Bank and multi-purpose cash support for shelter, and how they had taken certain actions to try to mainstream protection in that particular programmatic response. So thanks for sharing that as well from the Palestine colleague. Okay, if there are no further kind of comments or thoughts on those four categories, let's move to the next slide, which is where we're going to start talking about the benchmarks themselves. So this new operational tool, and what does it mean for you as shelter cluster coordinators? So first, what we're going to do is really look at what's in it. So, excuse me. So this document, the benchmarks, as we said at the beginning, was developed in about 2023 and into 2024 through a pretty consultative process involving some key clusters at that time. We didn't reach out to the shelter cluster, so apologies for that, but there's always a limit to how many we can reach in these processes. But we did engage very heavily with the protection cluster through our colleagues in the Global Protection Cluster who are joining us today. Also the Food Security Cluster, the WASH Cluster, and also significant consultation with OCHA's inter-cluster coordinators. We also worked in developing this document of the benchmarks with three HCTs, that was Niger, Venezuela, and Somalia. The document was then endorsed by the principals in 2024, and that's the document that I think you got in the attachment to the invitation for this event today. There are, sorry, maybe just a very minor point, but important one. So it is an official IASC document. The logo of the IASC has not yet been put on that document, so it hasn't been properly formatted yet. But the version you have is the final version, barring that logo. So please feel free to use it and disseminate it amongst your colleagues as you would like at this point. So let's look at the document itself. So it was designed to be as simple as possible. These things never are entirely simple. It was meant to be very short, and it's definitely a bit longer than we'd hoped for. But hopefully it's still fairly accessible and usable, although I'd be very interested to hear your thoughts for those of you who've had a chance to look at it before the call today. But basically the document sets out 3 benchmarks, and I'm going to explain what they each are in a second. So benchmark 1, or maybe just to say, sorry, that those 3 benchmarks, we chose them to basically follow what we would all as humanitarian operational actors understand to be key elements of a project, a program, or a strategic cycle. So we all do analysis and prioritization, whatever sector we're in, right? Even if you're just working on your own project, you do your analysis first, you prioritize what are the key needs that have come out of that analysis. Then you move to designing a response and then implementing the response based on that analysis and that prioritization you've decided upon. And then we monitor, we learn from, and we evaluate the intervention. And again, it might be an individual organizational one, it might be an intercluster, it might be a broader strategic intervention. But we generally go through that same cyclical process, don't we? So that's how the benchmarks were kind of conceived originally. So very simply, the first benchmark is on analysis and prioritization, and it requires HCTs to undertake continuous analysis, a continuous and comprehensive analysis, I should say, of protection risks. And really importantly here, we expect an HCT to do that analysis from the perspective of affected people. So we do expect HCTs to engage really effectively with the crisis affected people to understand those risks from their perspective. So what risks do they say they face? Which of those do they think are most serious? Which of those risks do they want us as a humanitarian community to help them address? So it's not coming in with a preconceived or a predetermined idea by us, particularly as international organizations with very specific mandates, but we're expected to have an open mind. We're expecting HCTs to listen to what affected people have to say about the risks and which ones they want to prioritize. The other element here that's really important is that idea of continuous analysis. So we all know that very often as an HCT, we might do an annual, maybe a twice yearly analysis of risks and needs. But what we want HCTs to get into is doing a continuous analysis of these risks, noting that risk factors are very dynamic and they shift over time. They can shift very quickly in some of the contexts in which you're operating. So we really want them to be able to understand those risks and how they're constantly evolving or changing. The other important element is that our analysis needs to include whether or how our actions are impacting upon those risks. So there's an intrinsic link here straight away to benchmark 3, which I'll describe in a minute. The prioritization element here is also really important. As I mentioned before, the policy expects HCTs to decide upon 1, 2, or maybe 3 maximum priority risks that they're going to work on together for collective action. And again, that's really important because there are too many risks in any given context for the HCT to work on. We expect them to really work out how to focus the capacities that they can bring to bear on those risks so that they can have maximum chance of having an impact on them. And how might they prioritize those risks? So in the benchmark document, you'll see that in that section on benchmark 1, there are some suggested criteria for how an HCT might decide to prioritize. And this is not, they don't have to do it this way, it's entirely up to them, but these are suggestions. So maybe just to flag them. One of the suggestions is that they think about what's the most serious protection risk as articulated by or explained by the affected people. So what are the most serious risks that they say are affecting them? And then secondly, to be very pragmatic, the other criteria we suggested was, which of those does the HCT think it might be able to have an impact on? Because if you think about the breadth and seriousness of protection risks in most of your environments, there are some protection risks that the HCT will not be able to have a significant impact on, or perhaps no impact at all. I'm thinking of, for example, of in Syria at the height of the war, in Palestine right now, there's a limit to how much influence a humanitarian group of organizations might be able to have for lots of different reasons. So the HCT might want to consider, is it worth me pursuing actions to try to address a risk that we know we can't have an impact on, but we want to still try for moral reasons, for ethical reasons, because that's the risk that the population want us to work on their behalf? Or do they want to consider working on other risks that they might be able to have some kind of impact on? There's no right or wrong answer. It is entirely, in my opinion anyway, for the HCT to decide on that. What I think we want the HCT to do, what this benchmark is trying to get the HCTs to do, is think about it. Think carefully, think strategically, look at all the analysis they have available to them, and then make a decision on that basis. It's not for me, Vicky, from headquarters to come down and tell them they've picked the wrong risk. As long as they've made and gone through that decision process and looked at all of the factors that are prevalent in their context, for me, that's what I would expect them to do. I can't tell them it's wrong. I just want them to think about it in as strategic a way as possible. So I just wanted to flag that element to you. So benchmark 2 is about response planning and implementation. That's the next stage in our cycle, remember, of course, and that's asking HCTs to, on the basis of that analysis, on the basis of that decision to prioritize 1, 2, or 3 of those protection risks, we expect them then to design and implement a collective, adaptive, multidisciplinary action plan to reduce those prioritized risks. It is still challenging to get different elements within an HCT, whether that's individual organizations or whether it's clusters, to really understand what contribution they can make to that plan. And we'll talk about your role as the shelter cluster in a minute. But it is important that each entity within the HCT understands how they can contribute to that action plan. So you've agreed you're going to work on whatever protection risk. So how can each of you use the capacities and the interventions you have to try to contribute to efforts to reduce that particular risk? And a couple of key elements here. So it's got to be collective, as we said. So it's all of the different elements of the HCT contributing to that collective effort. It should be adaptive in the sense that you need to be able to change your action plan if you see you're not getting any results. So try every other tactic, or refocus some of the resources and capacities in other types of actions that you think might have more impact if what you've tried already hasn't really worked. And it should be multidisciplinary, so looking at different types of interventions. And this is where you might also, hopefully, as an HCT, not just be looking at your role as humanitarian actors, but liaising with other actors working in that environment. So that would often be development actors, for example. And I'm thinking here very much about, for example, the situation in Pakistan, in Ethiopia, and in other countries where there is also a presence of development actors or development interventions too. It might be looking at what a UN political or peacekeeping mission is doing, whether you can have some kind of coordination and complementarity with what they're doing, etc. So that multidisciplinary is looking not just only at what you're doing as humanitarians, but seeing what complementarity you can have with the actions of other aid actors in particular as well. And then the third benchmark, monitoring, learning and evaluation. It's pretty obvious, isn't it? What we're asking HCTs to do is to regularly monitor and document any of the results they might be achieving through the implementation of this action plan, and then to make any necessary adaptations to that plan in real time to ensure that they can try to enhance the results that they are or are not yet achieving. So again, as I've said, so what we want HCTs to do is be very cognizant, very aware of where they're having an impact, and if they're not, to shift their tactics, to refocus their capacities and their resources in another type of action that might have more chance of impact, or stepping up actions that look promising in terms of having an impact. Should we put more effort into that type of action because it looks like it might be bearing some fruit? And the point is for HCTs to do that in real time. So generally, for example, in the humanitarian program cycle, it's quite a slow and cumbersome process where every year, once a year, we look at what results we're achieving. We don't want the HCTs to do that. We want them to be constantly aware of the dynamics, and we want them to make quite quick shifts in their tactics or their actions, depending on what's happening on the ground. So for the Syria colleagues, for example, the dynamic on the ground changed very dramatically in the last couple of months, didn't it? Very almost overnight, the situation changed. So that HCT is going through a fairly rapid process right now to shift their approach to protection risks. So they've had to understand how protection risks are changing, and they're trying to, on that basis, change their action plan and change how they're reacting to it. These things are never super quick, of course. They're an HCT, so they can't move very fast always, but they are already in that context, for example, going through this fairly quick process to adapt what they were doing on protection before to reflect what's happening on the ground. So those are the 3 benchmarks I wanted to share with you. I don't know if people have any questions about that before I move on to the next slide, which will be about who should use the benchmarks, just to clarify a couple of points on that. Any quick clarifications required on those 3 benchmarks? If not, no worries. If a question comes to your mind, then please just stop me as we go through. So Marman, if you could go to the next slide, please. So who should use the benchmarks? This is quite simple, really. The benchmarks are intended for humanitarian country teams to use to support their collective action to reduce protection risks. It sets out in the document some of the different roles and contributions of different actors within an HCT. So you'll see that there's reference to what the HC should be doing, and the HCT is this collective of leaders that sit and work together. There's reference to the intercluster level and the ICCG in particular, as well as some specific reference to the protection cluster, which plays quite a pivotal role in this process at the country level. It does already now, and I think hopefully it'll be doing more so as this whole understanding of centrality protection evolves. And then also there's reference to the role of other clusters as well, which you'll see. So the benchmarks are intended to support each member of an HCT in understanding where and how they can use their capacities to contribute to this collective response. So although it's designed for that interagency level where we come together in the HCT and at that intercluster level, you may find in individual organisations that this document would also be quite helpful in understanding how an individual organisation, NRC, IOM, whoever you may be, national actor as well, how they can contribute to that. So the tool is meant for HCTs, but hopefully it would be useful for other actors individually to look at as well. Next slide, please, Marman. So how should we use this document? So when I wrote some of these slides, I did it at the beginning of January this year, before this funding crisis hit us all. And certainly before there was this, the reprioritization exercise, and now this humanitarian reset discussion that's ongoing. And a lot of that, of course, is focused around the humanitarian program cycle. So what I had tried to do in this slide, the bit that's highlighted in yellow, was at that time highlight for the audience, let's call you, how the benchmarks relate to the stages or steps within the humanitarian program cycle guidance that we had by the end of last year for the 2025 process, those steps that we're probably all of us fairly familiar with. So I was trying to show how the benchmarks fit into that. Obviously, the discussions around the humanitarian program cycle are a little bit fluid, let's say, at the moment, so we're not quite sure what's going to happen to that process. I think the benchmarks would still be highly relevant to whatever happens to the HPC, and that's for a couple of reasons. So firstly, as I said before, the 3 benchmarks fit with, roughly speaking, that cycle, that process that we always go through as humanitarian actors, the project, the program, the strategic cycle that we go through, where we analyse, we respond to needs based on that analysis, and then we evaluate whether that response had any impact. So it's that cycle. So that's relevant, whatever the form the HPC would take, I would suggest. Secondly, when we wrote the benchmarks back in 2023, initially, for those of you who might recall, the HPC process was at that time already going through a reform process. So we couldn't be very detailed in describing how the benchmarks relate to the HPC at that time, because we didn't know what that reform 2 years ago was going to end up with in terms of the HPC format. So we had to write it in the benchmarks in a fairly loose way. So by accident almost, that means that the benchmarks, as you look at them now, are quite broadly applicable, as I said, to any kind of process to design, implement, and then monitor and evaluate some kind of collective response. The other thing to say is that when we wrote the benchmarks, we really wanted to embed a lot of flexibility in them in terms of how an HCT needs or wishes to take action to design and implement their collective protection response. So I worked for OCHA for many years in the field, working with HCTs, with humanitarian resident coordinators. And personally, I have a lot of trust, a lot of confidence in those bodies, in those individuals, in designing and delivering these kind of responses. You know, we should be trusting you guys in the field to be able to come together to do this. And yes, you might need some technical support at times, and that's completely fine. But generally speaking, you will know as members of the HCT what those protection risks are far better than I will do in your context. And therefore you, with some support, technically speaking, should be able to work out how perhaps to respond to them. And we all need support in terms of examples from other contexts, sharing learning, etc. But it's you guys on the ground that know what's happening in that context and what some of the responses should look like or could look like. So there's a lot of flexibility in the document for you guys to work out how to respond to that context and the protection risk in it. And then the last point here to make is that the benchmarks were never designed to be compulsory. We work, our system, the humanitarian system, is really based on voluntary action, really, isn't it? There's very little compulsory reporting on certain things. However, that said, reporting by HCTs on what they're doing to implement the benchmarks document. So what are they doing on analysis and prioritization? What are they doing in terms of their action plan? What stage are they at with that? How is it going in terms of implementation? And what are they learning in that continuous cycle about whether those actions they're taking are having an impact? All of that, I would suggest, should be included in any reporting the HCT does up to the global level. So, for example, that might be reported through the HPC process, depending on how that evolves and what reporting requirements will be placed on the new version of that. It could be in the HCT compact with the ERC. It could be through your cluster reporting up to the global shelter cluster, for example, to share with them what you and your HCT writ large are doing on protection. The more people report without it being bureaucratic, the more transparency and accountability there is to you, to your peers, to your donors, and importantly, of course, to the affected people. So the reporting is not compulsory at the moment, but I would suggest that some effort to report on how you're doing as an HCT and what, including your contribution as a shelter cluster might be, is quite an important thing to do that will benefit yourselves in the long run as well. Any quick questions on any of that? I'm aware I'm talking a lot, so please feel free to come in and ask any questions. There's a hands up from someone, thank you. Thanks, Amira. Okay, if no questions then, let's look at your role as the shelter cluster and you as individual shelter cluster coordinators. If you could go to the next slide, Marmon, thanks. So, what would you be doing if we look at that benchmark document and the 3 benchmarks in it? What does it say about you as the shelter cluster? It doesn't name check the shelter cluster specifically, but it talks about the role of other clusters. So as I mentioned before, the protection cluster will always have quite a particular role to play. For example, they are very often the entity within an HCT that is doing the analysis of protection risks that the HCT then uses to determine the priorities it wants to work on, for example. But the other clusters, yourselves included, play a slightly different role. So let's kind of work through what that might look like. What you can see on the screen there is my very tentative suggestions about what your role might be. And this role will probably vary, the reality of it will vary from context to context based on the type of protection risks, based on what the HCT has decided to do, which protection risks it wants to prioritize for collective response. It'll also depend on what capacities exist within different clusters, including within yours. So this is, please think of this as a draft for you to comment and contribute to, but also a kind of broad parameter. So there will be, again, a lot of flexibility and a lot of variation from context to context, and even over time within the same context. So what you might do at the height of an emergency, like a Typhoon Haiyan type crisis, will be very different to what you might be doing in the post disaster response a little bit further down the line. Okay, sorry, apologies for coughing. So benchmark 1, what would you be doing? So remember, that was about analysis and prioritization. So I would suggest that you, as the shelter cluster, produce a lot of analyses of shelter needs that very often include analysis of the protection risks that are driving those needs, or that are exacerbated or worsened by the lack of adequate shelter. So tying in here this idea of the right to adequate shelter, what does that mean when that right is being violated? What are proximate causes of those shelter needs that you're responding to in an operational way? And it is this connection between needs and protection risks that are driving them or making them worse that all clusters can help the HCT understand. And then on that basis, the HCT can make some decisions about priorities. So you, for example, I think again, the colleague from Palestine talked about stepping up data collection by shelter cluster partners on age, gender and diversity. So really looking at how different shelter needs were affecting different population groups, and presumably within that you're also looking at some of the reasons for those shelter needs and what was happening in Gaza. Of course, it was pretty obvious. A lot of it was to do with aerial bombardment and the military operation in Jordan, and how that was leading to the widespread destruction of residential properties or damage to residential properties. In other cases, there'll be different proximate causes, but very often your analyses might help us understand better the link between those protection risks and the shelter needs that then come from them. Maybe I'll just pause there. Does anybody else have any examples of where you have contributed analysis of shelter needs or the protection risk driving shelter needs to the HCT's kind of collective understanding of protection risks in any given environment? I think maybe that Typhoon Haiyan example that you shared earlier, Leo, for example, I think Caroline's mentioned it before as well in other sessions. And that one, again, might be an example of where you guys, as the shelter cluster in that context, understood some of the key risks that were driving shelter needs or exacerbating shelter needs and what possible solutions there were to that. But for other contexts, I wonder if anybody has any other examples of where you've done analysis of the protection risk driving shelter needs, either on your own or you've done that in collaboration with a protection cluster, for example. No hands up, so no problem. Feel free to chip in if something comes to mind in a second. So let's look at benchmark 2. So that's the development of the HCT's action plan. Mamouni, do you want to go ahead? Sorry, I saw your hand up.
Yeah, sorry, I raised my hand very late. So yeah, just share some experiences in the 2023 where we had several requests from the government to relocate IDPs that were hosted in schools, so that the schools can be open for children for their intended purposes. So in that period, I remember the collaboration of starting from the HCT impact, starting from the HCT down to the clusters. There have been a collaboration analysis on the risks. So the government made it very clear, if the children are not relocated, the IDPs are not relocated to alternative shelter options, the children cannot wait without going to schools for another year, which the children were already out of school for 3 years. And it was very prevalent that the government may use forced option to evict the IDPs. So in that period, we had to collaborate with all the clusters, particularly for us, as we were the frontliners for the request, because the IDPs need shelter for the relocation, and we have to be the one who should come with the alternative solutions to relocate the IDPs. In that case, we did several assessments and analysis on the risks. So we came up with alternative relocation measures, particularly in the form of constructing emergency shelters, as well as providing rental support for those who opt to go for rental support based on their preferences. We came up with 2 solutions, and we supported the relocation of IDPs from 21 schools over the operational area in the Tigray region. So I think this has helped somehow securing the IDPs shelter, as well as returning back the children to the school as well. So which would be quite challenging environment for the IDPs as well as for the community. As the community may, start questioning why the IDPs cannot be looking other alternatives as a children were out of school for students. Just to mention this. Thank you. Over.
Thanks so much, Mamuni. That was a really interesting example, actually. Chongkyu from Palestine, I think.
Well, I mean, it's good to hear about like good example and lesson learned. But on the other hand, I'd like to share my experience in the OPT for like top-down based, not concerted or not data-based example, and how it has been impacting the shelter cluster and also HCT during the ceasefire. So since the ceasefire, we as a shelter cluster, we were informed that you have to target of the 200,000 tents and also 60,000 prefab to bring in. And of course, we didn't even know where these are coming from. And we, at the moment, because of the delay in site preparation due to the challenges in UXO clearance, HLP issue, so there has been quite a lot of challenge to secure land, just a piece of land. And when we received this so-called order or request from the negotiation table, I mean, not only the shelter cluster, but national ICCG meeting and also HCT, we're all just panicked because we know that, first of all, it is difficult to bring in the logistic cluster has been facing challenges to bring in, and also for site management cluster, they are facing challenges to prepare the land. So, and also due to the blockage of the supply chain in the first 2 weeks, we are literally panicked. And then, after that, thanks to the lift of the supply chain, restricting many items to bring in the first 2 weeks of the ceasefire, we managed to bring during the 6 weeks of the ceasefire, we managed to bring almost like 120,000 tents inside. So it was almost like 60-70% of the goal on the negotiation table. But it has been making a lot of high level of the confusion, and also basically the cluster partners were not ready at all to implement this high level of the shelter material delivery. So it has been causing quite heavy tolls on the other shelter cluster partner, and also especially the logistics cluster partner. And after that, what we have been advocating at the national level, intercluster level, and also HCT level is the humanitarian community should be also be part of the negotiation table. So without this unrealistic goal, it was foreseen to be failed, and we're guessing that this unrealistic goal was set with a political reason, not based on the humanitarian principle or supporting the people. So that's what we have been facing during the ceasefire, and this is the totally opposite case of what we are focusing on. The protection mainstreaming or protection-based intervention. So I'd like to share this experience with other colleagues so that there is like super negative case like this. Over to you.
Thanks so much for sharing that. It's a bit of a reality check, isn't it? I mean, I think your experience is fairly extreme, but not as uncommon as we'd like to think either, in terms of humanitarian actors being dictated to by political actors in terms of what we should and shouldn't be doing. So certainly something that makes it really difficult to really embed protection at the heart of your response if you're placed under that level of pressure by political actors to take specific actions, and those actions aren't necessarily based on the analysis that you guys have come to as an HCT, then it's very hard to work within that framework. So thanks for sharing that. I don't know if any others have any questions for you or whether that story resonates with some of you as well. Okay, feel free to come back to that point if any of you would like to. So thinking now again about benchmark 2, so that's where you can contribute to the development of the HCT's action plan. So here what we would say is that the shelter cluster, of course, is not going to be the pen holder for the HCT's action plan. That would be fairly unusual or surprising that that was the case. But you should be part of the intercluster discussions and contribute as appropriate, depending on the priority of risks that are agreed. So, you know, there's a variety of contexts that you're representing here today. I'm sure that there's therefore a variety of instances or levels of input that you would have to the development of that HCT's action plan, and that would be very dependent on the context, as we said. Then secondly, you should for sure, as the shelter cluster in each of those contexts, look at your own shelter cluster plan and be able to articulate how your plan as a cluster, specialist cluster on shelter, can contribute, in what ways can it contribute to the reduction of those protection risks that the HCT has decided to focus on. And in some cases, it might be that there's a very clear link where most of your activities in your plan would help contribute to the reduction of those particular risks. I can't think of an example off the top of my head, but I'll try. In other cases, it might be that you might need to make some small tweaks, some small adaptations to show how your actions as a cluster would contribute to reducing those prioritized protection risks. But there might also still be actions in your cluster plan that aren't necessarily directly related to those priority risks the HCT has agreed upon, and that's okay. Not everything you do necessarily has to directly relate to those priority risks. There are other things that you guys need to do in respect of your mandate as the shelter cluster. It really depends on the context. So it could be that everything you do ends up addressing some of those protection risks, or it could be at the other end, some of the things that you do directly contribute to reducing those risks. It's very context specific. It would be very dependent on which protection risk that the HCT has decided to focus on its collective efforts. So those collective efforts, the priority of risk that the HCT is working on, may not always resonate with what you're trying to do as the shelter cluster. But as long as you can show how some of the work that you're doing is contributing to those, that would be satisfactory. Does that make sense? Does that, do you guys have any thoughts on that? About how your cluster plan might contribute to the HCT's collective action plan? It's quite difficult sometimes, this concept, to understand that there's a bit of flexibility there. It doesn't have to be everything you do has to change and be part of that collective plan. It could be that there are other actions that you're doing which have an indirect impact generally on protection risks in that environment, but at least there's you've made a conscious decision to try where you can with some interventions, some activities under your cluster plan to try to reduce those protection risks. That's as much, or that's the minimum we would expect you to do, let's say, let's put it that way. Any thoughts or questions or reactions to that? Maybe just to add here as well that you should be able to, and I think you often do already, call on the protection cluster to support you in understanding how shelter interventions that you're undertaking in your own existing action plan might contribute to the reduction of those priority protection risks that the HCT has agreed upon, and to help you work out how to do that. I mean, it's a mutual exchange, isn't it, between the shelter and the protection cluster. Protection cluster colleagues are not experts in shelter and vice versa, but between the two clusters, I think many of you work really closely together in different contexts. You should be able to work out how you can use shelter interventions to reduce some of those protection risks. I think a couple of you have given examples already, but if others have examples also of where that might be demonstrated, that'd be really helpful. I think, do we have Gree, are you still online? I don't know whether you have any examples, or Jim as well, I can see you're online. If either of you have any examples where the shelter and protection clusters have worked really closely together to identify, to respond to a particular priority risk the HCT has worked on. Are there any examples either of you might have to share at this point? Sorry to put you on the spot.
Don't worry. Maybe just, it's not an example, but I think sometimes it depends on what the risks that are identified, what they are. And it can be easier or more difficult, or you find your role, and it might not be everyone's role to contribute, as you mentioned. So I think that the examples you showed earlier, where there was one on the risk, I think it was of exclusion and so on, it's easier to say like, well, that has to do with how you program as either the food sector or the shelter cluster. So your role is then to make sure that the partners in your cluster keep this at the forefront when they do their programming, that there is a high risk of excluding certain groups or certain, ethnic minorities or something in that context. And that should be factored in the programming and in the strategies of all the clusters. Then there could be others, and I think the colleague from the OPT mentioned also like attacks on civilians and the real harm and violation. It's much it's much harder for an operational cluster to influence that or to mitigate those risks. That would be more at a higher level, that the representatives of the organizations of your partners are active in advocating where they can. If they have entry points, that could influence the parties to the conflict. But that would often, it would be a discussion in the HCT on who is best placed to mitigate those risks. So it's, the whole risk specter is from, where you have influence on how you are doing your humanitarian programming to strong advocacy and trying to mitigate those risks. And I think, many of the examples that have come up are really good, I think, from many of the operations. And I saw the colleague from Ethiopia, I think it is, had a question about like how we measure the impact of the protection monitoring. So I don't know, Vicky, if you want to say, I think in the beginning, in the intro of the benchmarks, there is the part on the AAP and like the contribution of that to, more getting the feedback from the communities and so on. Back to you.
Thanks, Uri. Thanks for your intervention there, which I think is really helpful. And thanks for highlighting the Mamuni's question, which I hadn't spotted. So I'm just quickly reading that. Yes, absolutely, Mamuni. So for those of you who haven't read the comments, so how do you quantify the outcomes of protection mainstreaming in a way that meets donor and stakeholder expectations? As you said, as you highlight, can be really challenging, and I'm going to come on to benchmark 3 in a minute. So could approaches such as documenting case studies, tracking community feedback, and analysing protection incident trends before and after interventions help demonstrate the tangible impact of protection mainstreaming, especially in resource-constrained settings? Yes, is the very quick answer to that. Those are some really good examples of how you can monitor or what kind of data and how you collect that data to use to illustrate whether you've had an impact in terms of mainstream protection, whether your ability to not exacerbate or create new risks has been improved by the actions you've taken to mainstream protection. I'm going to come on to that. I don't know whether, Jim, you've got your hand up, whether you want to talk about this aspect or something else.
Yeah.
Thanks for joining us, Jim.
No, that's okay, and I'm sorry I was late joining. And I see a couple of references to HLP issues in the chat and things, and I know some of you on the call, we've been discussing things already, but it was more a general pitch to say, totally hear the link with all of the work that Shelter Cluster does, and often there's HLP issues that come up. And just to say that if there's any, in your context where you're working, if you haven't got that clear link with the HLP AOR, either as a working group or if there isn't one that exists, then please do feel free to be in touch. Like following another one of these calls we had in a different region, we've had some follow-up conversations with the operations where there wasn't HLP coordination happening, and it's been kind of useful to start moving that forward a bit. So just to say that, yeah, hearing all of the examples around due diligence, around having to secure that land, prepare the land, and some of the issues that come up there that very much need a partnership between the HLP actors and those that are able to do that work. So just as sort of a general comment really to say that if there isn't that connection where you are, please do be in touch, and let's make sure that connection and that support is there. But yeah, please, if you have specific questions or issues, do come back. I'll be here for the rest of the call.
Thanks, Jim. Would it be useful for you to put your email address in the chat, maybe, for people to contact you? Is that an appropriate action? Great, lovely, thank you. There's quite a lot of people on the call, so you might be inundated today. Great, thanks so much. Marvin, did you want to come in on something specific?
Yes, I was thinking another example when we talk about the clarification of the role of the shelter cluster when contributing to these outcomes. And I was thinking we had indeed one example. It was it's a lateral example. It's not a part of one HCT protection strategy, but I found very interesting, and it's not in the call the country, but I think can be interesting. And it is related to the management of the beneficiaries' information and data following data privacy, when particularly in this case it was related to people living with HIV. And they had a referral mechanism in place, so protection cluster would inform about the cases, about people with a strong vulnerability, no, and without disclosing what it is exactly, what is the reason behind. No, simply they were sharing. We have these numbers of individuals in this particular site that they have strong vulnerabilities, and to be prioritized. No, and they would prioritize in terms of the response in shelter. And it was very interesting to see how professionally was discussed, no, that they didn't need the information about what it was exactly the reason of this protection vulnerability. They simply, they say in the shelter cluster, they don't have the partners, they don't have the expertise to protect this information and to make sure the individuals, they are not going to be stigmatized afterwards because the information has been leaked. So they simply had a breach, like a firewall, no? So they said, okay, we take care of referrals for population under a specific vulnerability situation, and the data privacy, it's ensured by protection cluster who has the partners properly trained for this, and they have their protocols in case. So I thought that was a very good practice, and I think it was interesting also to share it. It's more of a lateral example.
Thanks, Marvin. Yeah, I mean, I think that's a really important one for all clusters, isn't it? It's a really important example of mainstream protection. All clusters collect lots of personal data about individuals, about households, about communities, and obviously it's a fundamental requirement to protect that data for lots of reasons, but also because if you leak any of that data, you're potentially exposing those individuals, groups, households, or communities to harm. And we are dealing always with some of the most vulnerable people in society. So that harm, the risk of that harm is further exacerbated. I don't agree if you wanted to respond to that in terms of what guidance is already available on that. I mean, there has been a lot of discussion on data protection in the last 5 to 10 years with some quite specific guidance on it. But I don't know if there's anything you would like to refer people to on that point and the role of the protection cluster in supporting that.
Sorry, yeah, it has, I don't have it at the top of my head, but I could share it in the link later. In the chat afterwards, the links to these guidance documents, and also which operations were you from? What's your again?
That
some of the operations
in DRC. That was an
in
example
DRC.
from DRC.
Yeah, because in the different contexts, operations have also developed their own guidance on this. But let me get back to you, and I can also post some more general guidance in the chat afterwards.
Thanks, Grace. Sorry to put you on the spot there. I mean, there's, for example, the ICRC's professional protection standards. There's a whole section on data protection in that, which people might find useful to look at, for example. And there's been quite a bit of work in recent times, although obviously that hasn't yet translated to effective management of people's personal data on the ground, which is what I think you're highlighting there, Chen Q, in relation to Palestine again, unfortunately. But thanks for highlighting those issues, both Marmin, Gri and Chunkyu, and hopefully Gri will be able to share some more details with us on that for future reference. I just want to quickly run over benchmark 3 because that was raised by Mamune, I think, just to wrap up that. And then I can see there's a couple of other questions in the chat, which I'll try and answer before we finish in sort of 12 minutes. So maybe just to wrap up on benchmark 3, so measuring protection outcomes is really difficult. There is no way of hiding from that. It will take a collaborative effort across the HCT. It's not 100% scientific or 100% accurate. We don't have that kind of data. We don't have that kind of time. And we certainly don't have the resources, often in a humanitarian crisis, to really collect the kind of data we would like to understand what impact our actions may or may not be having. Again, the shelter cluster won't be the leader in the vast majority of cases of trying to document the impact of the HCT's collective action plan, but in some cases, you will probably have a more prominent role than others, again, depending on what risk it is that the HCT has prioritized, and Gri's already highlighted that a little bit earlier. But you should probably be part of the discussions on what indicators the HCT might need to set itself, and your cluster may well have data and analysis that can contribute to reporting against those indicators, again, very much depending on the issues that the HCT is working on. In the past, there hasn't been a lot of guidance on what kind of indicators are appropriate for different types of protection risks, what kind of data do you need to report against those indicators. It's been a question that the protection sector itself has struggled with for, since its existence, the last 10, 15, 20 years. In the last couple of years, Interaction, the American NGO consortia, has developed what they refer to as a measurement framework that might help some of you in thinking about how to design indicators, what kind of data collection methodologies might be useful. So we could share a link to that document. It's not an IASC tool, but there might be some elements in it that you could find useful. So if you are interested in that, then please let us know and we can pass that on, including sharing with you the contacts for the people in Interaction who have developed that. But reminder that one of the most crucial points in benchmark 3 is the expectation that HCTs will consider ways to adapt their action plan if whatever evidence they can get together against those indicators that they've set themselves suggests that risk levels haven't improved. So they really need to use whatever data analysis they can to measure whether they've had any kind of influence or impact on reducing those risks. And if they haven't had any impact, what do they need to change in their action plan? So I've highlighted that a few times now, so hopefully it's prominent in your minds. So just coming back again to the question that Mamune highlighted. So you've got in there, Mamune, a couple of different examples. And in trying to measure the impact of any kind of protection intervention, whether it's a specialist intervention from a protection mandated actor, or whether it's this collective endeavour of the HCT, you would need a range of methodologies and a range of data to be able to understand what impact is being had. And usually in a lot of the other operational sectors, people work very much with quantitative data, so numbers, statistics. And I think you probably do to an extent in shelter as well. But when you're looking at protection outcomes and the impact in terms of reducing protection risk, that can be quite hard to find. And even if you do find hard kind of statistical data, it doesn't give you the full picture. So very often in the protection sector or the protection cluster, we work with both quantitative data where it exists, but also qualitative data. And I think some of the examples and methodologies you've mentioned, Mamune, help us gather some of that qualitative data and some of the quantitative data there. So you're talking about documenting case studies. That would be great. So like looking with local communities, how have things changed? Have the risks they're experiencing as they articulated them at the beginning of your intervention changed in any way? So really asking them, how do they feel? Do they feel safer? Do they feel any of the risks that they were exposed to have reduced, stayed the same, or have got worse even? So that's a really important element, asking the people themselves. That would be the first and foremost. And that can be very difficult in insecure environments where you don't have much physical access to people. But with modern technology, there are ways in which we can ask people for their experiences and their opinions, whether that's through the different systems put in place for accountability to affected people, hotlines, surveys, using SMS, using other types of modern technology to reach people. Again, as related to that, of course, is that tracking of community feedback. And in the old days, we used to go and sit with community leaders and ask them. We still do that. We maybe don't do that as much as we could or should in our different clusters and sectors, or as the HCT writ large. But the more emphasis and a more investment we can make in that, then the better we'll be able to understand protection risks and how those are changing and whether they're changing in relation to some of the actions we're taking or not. And then, as you mentioned, analysing protection incident trends. So that's protection incidents. So, for example, attacks on civilians, the numbers of people being displaced, for example, whether that, that might also include a wide range of different risks that would be pertinent to shelter risks or the needs in the shelter sector, for example. And combining all of those different pieces of data will give you a better idea of how the protection risks are changing and some idea maybe of how those risks might be changing in relation to the actions you have or have not taken as the humanitarian community or the humanitarian country team in your given context. But it's always going to be, I'll be frank with you, a little bit messy. It's never very easy to do this. I think what the benchmark 3, what the policy is asking you to do as an HCT is to do your best. There is no perfect way of doing this. Try different methodologies, try and collect different types of data, and then whatever you can get, you put that together as an HCT to really see, is there any change in the risk profile in this context? Are those risks reducing? Have they stayed the same? Have they got worse? And what do we think might be causing those changes, or if they haven't changed, why not? So it's really making the best you can of the data that you can access and can collect and bring together. I don't know if anybody has any specific questions on that before I look at the last couple of questions that are in the chat, but any comments, thoughts, reactions, any experiences you'd like to share about trying to monitor the protection outcomes of shelter interventions specifically, or your role in protection outcomes as the shelter cluster or sector? Any thoughts? Chunky, yeah, please go ahead.
I don't know whether I can put this question at this moment. It's not really linked with the other benchmark, but can I, or should it be separated first of all?
Sorry, should benchmark 3 be linked with?
No, basically my question is linked with how we can. It's a long-standing question by myself. There is huge trend to mainstream, area-based approach, and I can understand that to maximize the impact, especially considering the fund and resource invested. But on the other hand, my question has been always, what if we are, in case we are focusing on the certain area, then what about the people who is out there, not accepting to the humanitarian assistance? What about the other protection for them? And it's a little bit different from this benchmark discussion. But on the other hand, I don't know whether other colleague has a similar question, thought about that. Has any idea in this, question that I have been having for years. So, but I was not sure whether I can pose this question. Definitely, this is linked with the protection, shelter, humanitarian assistance, but I'm not sure whether it is relevant to this benchmark discussion. Over to you.
Thanks. If I understood correctly, and please correct me if I'm wrong, I think what you're asking is, when the HCT sets its priorities on i.e. which protection risks it's going to work on collectively, in most cases that won't be the only thing that the HCT does. It's a set of priorities. Things have got more complicated recently because of this funding crisis and the reprioritization exercise in general that HCTs have been asked to do. So it might be a little bit linked to that. But initially, the idea is that, yes, protection should be at the heart of everything an HCT does. And what does that mean? At the bottom line, it means protection must be mainstream in every single action that you take as an HCT, every project, every intervention, every conversation with the government, every conversation with another type of duty bearer, protection should be at the heart of that. It might be in some cases that the HCT's priorities in terms of the protection risk it wants to work on become most of the collective effort. So most of the work that an HCT does is really focused around those. But in most cases, there will still be other activities, other protection risks, and other humanitarian needs that members of the HCT are still working on. So I mentioned this a bit before, I think in regard to your contribution as the shelter cluster. So how does your cluster plan contribute to the HCT's action plan on addressing the priority protection risk? So in some cases, most, if not all of your work would be really directly linked to reducing those priority protection risks. In other cases, and Gree gave us some examples, I think, in other cases, some of the work you do as a cluster will contribute directly to the reduction of those protection risks. And some of the work you will continue to do will not necessarily be directly related to that. So it really depends on the context. And that's the level of flexibility that was put into the benchmark document. So because every context is so different, does that answer what you were talking about? So you talked about area-based programming. So it might be that, for example, that an HCT decides to work on this geographic area in their context because that's where they feel the protection risks are most serious. But that does not mean, in my opinion, that the HCT members and clusters stop working anywhere else. That might happen for a number of reasons, but the benchmarks aren't telling you to do that. It's for you to decide. Does that answer your question?
Yes. Okay, noted. Thank you.
Okay, thanks. So then I think we had another question from Robbie, who I think you're the Pacific Regional Coordinator, who is ultimately responsible for leading this process, acknowledging that if it's everyone's responsibility, then it might not get actioned. Yes, absolutely, completely agree with you. I said before that the benchmarks have a lot of flexibility built into them, and that is true in terms of also who in an HCT is meant to lead this process. So if I look at how different HCTs around the world have sought to embed protection in the way that they work at that strategic level, it looks quite different. In Somalia, the HC has a what's called a PROCAP, special protection or senior protection advisor. So that's like a P5 level individual who is seconded into the HC's office. And that individual in that context has been leading the HCT's kind of working level discussions about the centrality protection and how they deliver on that in the course of the HCT's overarching humanitarian strategy. So they've been convening meetings, they've been advising the HC on what steps to take. They've been pulling together with the protection cluster and other actors some of the analysis about what are the protection risks that are particularly prevalent in that context and how should the HCT collectively respond to them. In the Syria context right now, I mentioned before, I think we've got a colleague from Syria online, so please correct me if I'm wrong, but I believe that UNHCR as the protection cluster lead agency has, under the authority of the whole HCT, been leading a process to reanalyze now what are the most prevalent protection risks in this current environment, noting the shift in the dynamics of the conflict, and supporting or kind of coordinating the process in the HCT to agree on some priority protection risks, and then move on to developing HCT action plan to respond to those protection risks. So in that case, it's the protection cluster and UNHCR in particular that's leading that process for the HCT. In other cases, it's a combination of actors. So the benchmarks the benchmarks and the policy itself try to give a lot of flexibility, but ultimately the humanitarian coordinator is the leader of the HCT. So that individual will be expected to make sure that these things are happening at the working level, and that they and the other heads of agencies, so the HCT, collectively are ensuring that there is an analysis, that they are taking a decision on what priority risks or what risks to prioritize on the basis of that analysis, that they are overseeing a process to develop an action plan, and they're facilitating the kind of programmatic level colleagues to implement the programmatic components of that action plan, and that they are probably, it's probably at their level, as I mentioned before, they are engaging in, for example, the advocacy that is part of that action plan. So going to the government, going to other conflict parties, going to the private sector or other duty bearers that they may need to engage with to try to promote the rights of the civilians that they want to stop from being violated. So ultimately it's the HC and the HCT, i.e. the heads of agencies, but in terms of the day-to-day management of the process, that can vary. It can be a PROCAP advisor, it might be the protection cluster, it might be a combination of those things. In the Venezuela HCT, certainly again, it was a senior PROCAP advisor who has been working with the protection cluster and other clusters to lead that process. So there's a little bit of flexibility, but ultimately it is that leadership level that are expected to make sure that these things are happening. And in the benchmarks, in benchmark 3, you'll see some points about holding people accountable for making sure these actions are happening, that there is an analysis, priorities are agreed, an action plan is developed and implemented, and the impact of that action plan is being monitored and evaluated. And when we were developing the benchmarks, we were not able to get 100% clarity on who and how would individuals be held accountable. So in the benchmarks, we put a couple of different actions that we think would help with regard to accountability. So for example, there's a reference to including in the HC's compact with the ERC an expectation that the HC would demonstrate how they as an individual had led their HCT through this process and what results were being achieved. Similarly, we expected or suggested that the HCT compact with the ERC, as much as those documents are functional, would also be an opportunity for the HCT to members to demonstrate that they are taking these actions. We also, quite importantly, put in that document that we would expect individual organisations to look at the terms of reference and the performance appraisal of their heads of agency or head of organisation in any given context, and make sure that within their agency performance appraisal system, that head of the organisation, that country representative, is also expected to report on how they have ensured their organisation in whatever context has contributed to this collective effort. So there isn't one kind of accountability mechanism. We try to suggest that there are multiple ways that the elements or the entities and the individuals within the HCT structure can and should be held accountable for delivering on the actions explained or set out in the benchmark document. Robbie, does that help answer a bit your question?
A bit. A counter question, do you think that's enough? Do you think that's enough to ensure a level of accountability? Because it feels to me like it's still quite siloed in the protection cluster. Over to you.
Yeah, good question. Thanks, Robbie. Yeah, I mean, I think you're right. Do I think it's enough? No, I don't. However, if you were able to use properly at least those 3 avenues of accountability that I mentioned, so if when the HC reports up the chain to the ERC and his team, it's a man right now, of course, actually say, tell me in detail, what have you led your HCT through in terms of centrality protection? What have you done and what have you achieved? If that was a really concrete conversation that was held, then that would increase the pressure on that HC to demonstrate their individual personal efforts. Similarly, when the ERC is looking at the reporting from HCTs against their compact with him, he should be interrogating, or him and his team should be interrogating the information the HCT is providing. And then for me, one of the really critical pieces in this accountability line is that individual head of agency. You know, I'm not picking on any individual agency here, but, you know, UNICEF, the head of the UNICEF office in any given context, if that individual knows that they're expected to demonstrate how, back up their chain to their principal, if they know they're expected to demonstrate how they have made UNICEF in Somalia contribute to this collective effort and what results they have achieved in that regard, then that will put, again, increased pressure on that individual in that agency, in that context, to take the action that we would expect them to take. So each on their own, those avenues of accountability would not be enough. That's why we put multiple opportunities or suggested multiple opportunities in the document. But for me, it all hangs on, are the principals of your individual organisations and the ELC going to ask for this information and interrogate the information that you report back up and push when they feel that you're not doing enough? That's the bit that needs to happen to make this accountability line more effective. There won't ever be a perfect system, but if those opportunities were used more robustly, we would probably see a bit more accountability. I don't know what you think about that, Robbie, or anyone else, if they want to chip in. I know we're a little bit over time, so apologies.
No, thanks, Victoria, for the additional comments. Appreciate it.
Okay, great. Well, listen, we are 8 minutes over time, so my apologies for letting that run, but hopefully you all feel, or those of you who are still with us, feel that you've had at least some opportunity to contribute as well as listening to the conversation we've had today. From my side, thank you so much for giving up your time. I know 2 hours is a long time in your working day, so I really appreciate it. And thanks so much to all of you who have shared some examples, asked questions, given comments about this topic. They're all very well received. They help us all understand from our perspective at headquarters as well, as much as you guys in the field. I think that sharing of learning and questioning is a really important part of this process. Centrality protection is not, it's not necessarily an easy concept to understand or an easy concept to operationalize. So this is not something that we'll all do immediately. It's an ongoing learning process. So I really appreciate you helping with us as part of that. Was there a quick hand up there from somebody? Is it why you? Maybe, I'm not sure. If no last questions from any of you, I don't know whether Seki or Marman, you wanted to add anything, or Gree, any closing remarks?
Yeah, no, I just wanted to just close the meeting. Really sincere thanks to everybody who's contributed. Your kind of case studies really highlighting the real protection risks that you concretely and continuously work to address. And I thought that it really showed that the shelter cluster is doing a lot, but then at the same time really grappling with these complex issues that's been aired today. So I heard our voices of our colleagues who wants to do more, who wants to stand up for the rights to be protected. And I think this IASC benchmark is a renewed opportunity. So I think I encourage all of us to really proactively engage with this work, with the HCTs, to highlight the risks that are important to our sector. Our sector, especially related, not exclusively, but related to adequate housing, the right to adequate housing, and of course we've got the shelter and settlement standards in Sphere that is based on those rights. So yeah, so in order to do more, I was thinking, and I've been hearing all the contributions to say, like, it's a collective effort. We must work closer with the protection cluster, with the HLP, AOR. I heard in the text there, PSCA working group, CCCM, WASH, like working really collectively on this is going to be key if we want to do more. So from the global shelter cluster side, we are keen to raise the issues that is important in country to the global level, really work with you to identify opportunities to resolve these and take them forward. And yeah, let's not lose momentum. As in, let's use this to again create this momentum. We will be following up with a summary in email, with the recording, with the PowerPoints on our website, etc. So I encourage everybody to share as appropriate to your staff and to your colleagues on this. And lastly, I just wanted to thank Vicky really for your time and dedication. 3 sessions for our cluster. We have now a great resource that we will continue to champion. So thanks, Vicky, for all the work that you've done before and for this rollout. Just wanted to thank Marmin and Caroline as well for really working with us to organize this, and the protection colleagues, Gree, Jane, Jim. Really, we will work really closely together based on this, and I encourage all of our country clusters to seek those relationships too. So we are here together, and thanks everybody.
Thanks, Eki. Goodbye, everyone. Thanks again.
Thanks, everyone.
Thank you.
Bye.
Thank you. Maraming salamat.
Bye.